Hi everybody, welcome to SRH Access Facebook Live. I am Lexi and I'm here with Scottish Rite Hospital surgeon Dr. Anthony Riccio and Dallas area orthopedic surgeon Dr. Zide. Thank you guys for joining us so much.
Thanks for having us.
And we're going to talk about, these guys have a really interesting complex foot and ankle clinic here at Scottish Rite Hospital. So why don't you guys just kind of explain what that is and what you do?
Well, it's a few years back, we were sharing notes on some difficult patients each of us had. Dr. Zide had some complex adult patients who were dealing with sequelae of pediatric congenital deformities, and I had several older adolescents in my clinic with very complicated problems that I thought could benefit from the techniques that adult, fellowship-trained adult foot and ankle surgeons employ in their practice all the time. And as we kind of started to share cases, we realized, well, it'd be really interesting if we could kind of put our heads together for these types of problems. And out of that was born the Scottish Rite Complex Foot and Ankle Clinic, which, as far as we know, is a one-of-a-kind clinic where older adolescents dealing with again, sequelae of really complicated pediatric foot deformities, many of whom have had multiple surgeries in the past, can come and be seen, and they can kind of get the expertise of a pediatric specialist with an interest in those types of deformities and what leads to them, as well as the expertise of an adult fellowship-trained foot and ankle surgeon who's very familiar with kind of the cutting-edge surgical options available to adults with deformities that pediatric surgeons really aren't aware of or have yet to adopt. And in addition to the adolescents, we're also able, through the foresight of our institutional leadership, to be able to even bring in young adults who basically aren't being seen in the adult sector because many adult foot and ankle specialists feel that sequelae of pediatric problems is a little too bizarre and out in left field to manage.
That's great. So is this something, how long has this been going on, and does this happen once a week, or how often are you guys doing this clinic?
So we have the clinic once a month, and we operate together once a month. I think we're in our 4th year of doing this, and it's been a very unique and fun opportunity, I think, for both of us.
That's exciting.
Yeah. When we first started, we didn't know if it would be something that would take off. We thought there might be a need.
Right.
We expected to have lots of very small clinics and very few patients coming to see us. And 4 years later, we're booked out surgically months in advance, and it's one of the busiest clinics in the hospital as far as I know.
And so are you guys seeing, for people that maybe don't understand all the medical terminology, are your patients, having a condition they're born with that they're needing your help with? Are they involved in injuries that are causing something to happen? Or can you walk me through that?
So it's a little bit of everything. We see certainly congenital deformity and problems. We also see developmental problems and traumatic problems. We also see a lot of revision cases, patients who have had surgeries done elsewhere that did not go as they were supposed to. And so it's sort of a mixed bag, a little bit of everything here.
Right. We're in a hospital, they're paging people. We got to go with what happens
Sorry
live.
about that. It's not us, so we can stay.
Exactly. And so what, I guess, is there a certain type of case that you guys feel like you're seeing more often than others, or is it all across the board?
The cases range from very relatively simple deformities like young people who have, say, bunions, all the way up to very dramatic deformities resulting from something common, say like an infant who's born with a clubbed foot. The correction doesn't go as planned, the usual treatment course deviates somehow. Child ends up having multiple surgeries, very complex deformity, and despite seeing numerous specialists, no one really has an answer for them. And those are really those are the types of cases that we really, I think we can offer a lot to, because if sometimes maybe I feel as the pediatric guy, maybe I don't know all the little surgical tricks to make something turn out the way we want for a patient with a really difficult, multiply operated foot deformity. And sometimes Dr. Zide doesn't understand, as not thinking about the congenital nature of it and what goes along with that, some of the nuances of ways certain muscles pull or certain muscles and soft tissues will react to correction as much, but together we're able to kind of provide the best of both worlds and do some pretty impressive things for kids with really difficult problems.
Yeah, putting your heads together. And
Yeah.
we also have one of y'all's patients here today. Do you guys want to introduce Larry? He's sitting over here very patiently, very kind to be here with his mom. Are you going to walk us through his case a little bit, or?
Well, I think maybe Mom can talk about his case a little bit since she's been there from day one.
Yes, Larry was diagnosed when I was 5 months pregnant with club feet. I already knew. He went through numerous surgeries. Then we just came over here. We got the word from a doctor, a specialist, saying that if it was their child, they'll bring them to the Texas Scottish Rite Hospital for Children. And I said, give me a number and an address. And we were here. We've been coming here the last 10 years and getting answers that, I never even heard of. I never got answered. And seeing Larry, develop and grow up and now have this surgery, we're pretty excited about everything.
Larry, what's it been like to be a patient here for 10 years?
It's been wonderful. They have the best care, the best nurses, one of the best surgeons. It's been a great time here.
Larry, can you tell everyone about kind of the deformity you were left with in your foot, what it made, how it affected your life, the things you could do, the things you couldn't do, the pain, that kind of stuff?
I was left with club feet for both my feet, but only one was corrected, and this one was the most severe case. And we came here and talked to Dr. Riccio and Dr. Zide and a few other doctors, and they made some plans. And
I think we actually have some pre-op photos. Dr. Riccio, do you want to walk us through
Sure.
maybe some of what we've got over here?
Oh.
I don't know if you can.
I don't know how to unlock that because, there we go.
There we
So
go.
here's Larry. Here's a picture of Larry. So Larry had a multiply operated club foot, and one of the issues with club feet is the tissues are fairly non-compliant. And anytime you do surgery on a foot or any extremity really, scar tissue develops and the non-compliant tissue becomes more non-compliant due to the scarring. So Larry was left with a deformity where he basically was forced to walk far up on his toe. All of his weight, and he's a big guy, he's a power lifter, was being put across the forefoot. And due to that, he was having a lot of pain. He was having significant difficulty wearing shoes. And unfortunately, not only was this a severe deformity, but it was a very inflexible, rigid deformity. And when joints don't move the way they should, joints in the foot, and in his case, the ankle as well, it really limits your options surgically.
And so you want to come back over here to Larry. Talk to us about what some of the options were for Larry. I know you guys were mentioning earlier, Larry, amputation was maybe something that was thought of before you met with Dr. Riccio and Dr. Zide?
I think, Larry, you had seen several people before you came to us, right? Yeah. What kind of surgeries did people talk to you about as far as getting this fixed up for you?
Like talked about amputation and a little bit about the fixator, the frame, and I just went with the frame.
Yeah. I think Larry was ultimately referred to our clinic. I think you were ultimately referred to our clinic because you and your mom, and she's here and she can correct me if I'm wrong, didn't want to go the route of amputation, which is kind of what you had heard repeatedly, I think. And so they referred they referred you folks to us to see if we could get creative. And
Yes.
to be honest with you, that's when we talked about kind of gradually correcting your deformity with the assistance of an external fixation device. But I'm not going to lie to you, and I think you'll remember many of the conversations we had and you had with Dr. Zide. We were a little nervous to proceed in that route because, you know, one thing about amputation is very dramatic, but it gives you a very reliable result. Whereas kind of coming up with a novel solution to a complex problem in a difficult foot, you never know where you're going to end up. But I think in this case it turned out pretty well.
Was there something specific about Larry's case that allowed you and Dr. Zide to really work together and do the collaboration?
You know, I think that Larry had been dealing with this problem for so long, and he had goals in mind, which was really helpful for us to be able to know what he wanted out of this, and to be able to continue powerlifting and to
Football and baseball.
absolutely playing sports, and just to not have to have an amputation, be able to keep his own leg. And I think that through our collaboration, as well as with some of the other folks here at Scottish Rite, the plan that we designed for him allowed him to do all of those things and keep the length that he already had in his foot. He already has a short foot from having a club foot deformity, and many of the other solutions that didn't involve using the external fixator like we ended up doing would have shortened your foot substantially. And so being able to keep the length that we already had was really a big benefit to what we did.
Larry, do you have any tips for other people? I think we've got some comments on here. People are giving you shout outs. Any ideas of things you would want to let people know if they're going to have an external frame? Anything you would say to other people that might be afraid of this or the journey you've been through?
The frame, it looks very scary. It hurts a lot, but I think it's the best choice to go with. You know, in the long run, in the long run, it's just gonna make you even better. If I had to go with this again, I would do it again.
What has it allowed you to do now? What are kind of the things you're looking forward to?
I've always wanted to put this foot in a flat-footed shoe, and that was literally a dream for me. And now, thanks to the doctors and everybody, they helped me get that dream.
And Mom, what has this been like to watch Larry go through all of this? And
It's been amazing. It really has. I mean, he's grown so much. I mean, for him just being 15 years old, he's a young little man already. I mean, making adult decisions. I have to take his, opinions into consideration now. I mean, it's his life, but I mean, I thank y'all both. I mean, y'all truly have made a future for my son that we wouldn't even think was possible. And now the limitation, it's unlimited now. I mean, the sky's the limit for Larry. And the way he adapted to before this, I mean, look out, he's about to shine.
any advice for other parents that maybe have kids in similar situations? Or
My advice is Texas Scottish Rite Hospital. But definitely go with your gut instinct. Listen to your kids. Do not limit to them at all. I mean, push them, because you never know what they're capable of doing and becoming. Don't be afraid. Always put God first, and everything else will come into play.
thank you guys so much. And Dr. Riccio and Dr. Zide, how does somebody become a part of your clinic? How do they get here? How does that work?
So we are, at this point, it's interesting. Word's gotten out a little bit, and at this point we receive referrals from all over Texas. We've received referrals as far as California, Tennessee, Boston even at this point. Folks are coming down. So, I think most of these patients just hear about it, call Scottish Rite and request a visit in the complex foot and ankle clinic. A lot of our referrals come from orthopedic surgeons, either foot and ankle surgeons or pediatric orthopedic surgeons who have kind of reach the end of what they feel they can offer, or maybe feel that what might be necessary for treatment is a little beyond what they're able to accomplish at their facility. Maybe it doesn't have the support that Scottish Rite does, and so we get a lot of referrals directly from folks we know in the foot and ankle world and in the pediatric world. But we're wide open, and we welcome anyone to come in and visit with us. It doesn't have to be, as difficult a problem as Larry had, but
He's here to test you.
we're just, well, he's here to show us. Larry, we were talking about this earlier when we had our visit today. It's funny, you learn, patients, we like patients and parents to leave educated, but we learn a ton from every patient we interact with and everything we do. And I think, and I'm not going to speak for Dr. Zide, but what I learned from Larry is, there was a lot of apprehension going in and seeing if we could correct a deformity as complex as his safely and without, doing any harm, which is always how we like to proceed in the practice of medicine. And there's always going to be apprehension when you tackle complex deformities, but next time we encounter something like this, I'll have Larry in the back of my mind, and I'll remember it worked out, and I'll remember the little bumps in the road we hit to get there, but where he is now, and it just shows us that we can keep pushing the envelope, which is really why we started this whole clinic, is to treat adults and kids who didn't really have anywhere else to go.
Right. And when you mentioned the support that Scottish Rite Hospital has, we really pride ourselves on treating the whole child. Talk to me a little bit about who all is involved on this team and how that works together.
Well, the team is huge, and it can grow and contract based on what kind of problems we're tackling. So Dr. Riccio and I sort of lead the surgical and tactical planning. We have a nursing staff that is always with us that helps to coordinate and to facilitate things for our patients. We have physical therapists, orthotists, prosthetists. We've got specialists in things like we did for Larry. We have extra doctors who come in and help with the external fixators. And we have the other physicians that Scottish Rite has around, like rheumatologists and neurologists, to help us with some of these more complex problems, congenital problems, and disorders that a lot of these kids have.
We do have a live question from Justine Williams. She wants to know, how did you guys feel after Larry's surgery? Maybe you want to answer that, and then maybe Larry, you can tell us how you felt after.
Who's it from?
His sister.
Oh, it's from your sister?
All right, sister.
How do we feel? Immediately after the surgery, very excited about the future and what it would look like over the ensuing months. The method we use to fix Larry is a method of gradual, careful, slow correction, where we cut a bone and we slowly correct the deformity through that bone, and as new bone more or less grows behind it. It's not a technique that's commonly used for foot deformities. It's commonly used for limb length differences and lower extremity and upper extremity deformities, but the applications of the foot haven't been tested, and it hasn't been done all that often even here at Scottish Rite, where we have a very robust experience with deformity correction using this device. So I kind of felt like we were a little bit of pioneers, and I was looking forward to where the trail was going to lead us. And this is where it led us to.
Larry, how did you feel?
In pain.
Yeah, I was like right after the surgery, I was real out of it, nauseous, angry, moody, and everything. But the next day, whenever I felt a little bit better, I was just excited to where this will lead me, and now we're here and reaching for greater heights.
Yeah, they're like a part of your family now, almost, it seems like. And Dr. Riccio, you mentioned this technique you use on Larry hasn't been used that often. Is there a research aspect to all of this?
Yeah, it has. Well, it's been used commonly for lower extremity deformities. It's just the applications to the foot it's kind of the next step in the application of this device, I guess. So we have a very rich research component to what we do. In fact, Dr. Zide and I have a very well-run research registry for not only really difficult foot deformities, but also really the more run-of-the-mill foot deformities we see in adolescents, flat feet, coalitions, which are abnormal fusions between bones in the feet, which are painful, high arched feet, bunion deformities. And so we work with folks down in our motion science lab. We can see what pressures are generated as the foot hits the ground. Our patients fill out little report cards on how they're feeling, how they're doing, what their function is. And of course, we look at radiographic measurements and physical exam findings. And our hope is to kind of correlate this all together to move the field forward a little bit, learn more about adolescent deformities, learn when we don't need to do surgery to make someone feel better, and learn when we do, and get an idea of what the outcomes of those surgeries are so we can better educate our parents.
Yeah, helping other kids in the future too. So is there anything else, I think maybe final question, that you guys want families to know about your clinic, or what you would say to them if they're watching?
No, we love this clinic. This is coming over here is the highlight of my month, and I like the challenges that it provides. I like the camaraderie amongst the team. We just absolutely, we love our patients, we love our team, and we love being over here. And sort of tougher problem the better. We really enjoy it.
That's great. Well, thank you guys so much for spending time with us, and thank you guys for
Thank
sharing
you.
your story. Join us next week for our next episode of SRH Access Live.